Hi, my name is Brian Reiter, and today I'm going to talk to you about ACL, or anterior cruciate ligament reconstruction surgery. The anterior cruciate ligament, or ACL, is one of the four main ligaments connecting the femur to the tibia. The ACL provides stability as you specifically rotate your knee. A torn ACL may occur if your knee joint over-rotates or if you receive a direct hit to the front of your knee. If your ACL tears completely and you have symptoms of instability that do not improve with physical therapy, we often recommend surgery to reconstruct the ligament. For the procedure, oftentimes you'll receive both a combination of regional anesthesia or a nerve block, but also general anesthesia, which allows you to sleep for the entire procedure. During the arthroscopic procedure, I'll make a few small incisions around your knee, at which point I'll insert some surgical instruments, including a camera and other small instruments, to transmit the images to a TV monitor, and the entire surgery is done while watching on this TV monitor. First, we'll do a diagnostic arthroscopy of your knee to look in all the compartments. We'll address any cartilage or meniscus injuries that may or may not have been seen on the preoperative MRI. Then we'll remove the remaining portion of the torn ACL from your knee. Next, we'll prepare your new ACL graft on the back table. There's multiple options for ACL grafts that may be your own tissue or in some cases donor tissue. Next, we'll create the attachment points for the new graft. This occurs on both the femur and the tibia by drilling small tunnels with the arthroscopic instruments. We'll place one end of the graft into the tibial tunnel and one end of the graft into the femoral tunnel, and there are different ways to secure them, but ultimately they will hold the graft in place until your body grows into your new ligament and turns into your new ACL. Oftentimes we'll use small screws to wedge the grafts in place while they heal, and these screws are made out of a bioabsorbable material that actually turns into bone over time, so there's no fear of having large metal screws in your knee. It takes about 6 to 8 weeks for the graft to heal into the bone, enough that you can come out of your knee brace and start beginning more activity. So for the first 6 to 8 weeks, you're protected with crutches and a knee brace. Once we're finished with the ACL reconstruction, we place your knee in a bandage from your thigh all the way to your foot, followed by a knee brace on top with a cold compression bandage underneath, both for pain and swelling purposes. You're then woken up and brought into the recovery room, where you'll stay for about an hour before you go home. You'll see me again in the office about 1 week later, where we remove your sutures, discuss your surgery, and I give you a prescription for physical therapy. The physical therapy is very regimented, and I have a protocol for you to either give to your own physical therapist, or certainly you can come to our physical therapy here at Atlantis Orthopedics. The physical therapy lasts about 6 or 7 months to fully recover from an ACL reconstruction, and that is going to give us our best chance at restoring you to your previous level of function.